everyone, it's Phil again from Healthcare Business News, and today I am joined by Berndt Schmit, who is a physician and radiologist living in Tucson, Arizona, working at Banner Health. But Dr. Schmit is also involved in charity, so Dr. Schmit, thank you for joining us.
Hello, Phil. Thanks for having me. Exciting times.
So I met Dr. Schmit at RSNA this year, and he told me about his the charity that he started called healthcare, or what? Tell me the name.
Humanitarian
Humanitarian.
Radiology
That's right.
Development Corps.
Humanitarian Radiology
CORPS, like
Development.
a group of people.
Yeah.
So yeah, it's a mouthful. So we use the acronym HRD Corps, and we say hardcore to identify ourselves. And
So
it's kind of an inside joke, frankly.
just in case everyone didn't hear me or hear us because we were both talking, it's Humanitarian Radiology Development Corps, and because they have a sense of humor, call it hardcore.
You got
Now,
it.
where has I'll use it hardcore. Where have you had successful charitable operations?
You know, most of our work is in Haiti. Gosh, we probably work with 10 different hospitals or clinics around the country. And it seems what has evolved over the last few years is we do a lot of ultrasound donations. So we have a special relationship with a vendor that provides us with refurbished Sequoia ultrasound machines. And Hardcore then does the bit of assessing, is a program ready for ultrasound? What else do they need for a program to be successful with ultrasound? Then we manage the donation, so that's logistics, the customs clearance, transport, and then once the equipment's on site, we may be long-term engaged with training, depending on the facility. So some of our ultrasounds, for instance, go to public hospitals where they have OB physicians who are very good at ultrasound. They don't need any training, so that's one of those kind of convenient projects for us. We do the assessment, we donate the equipment, they're good to go. We keep logbooks on, the number of cases, just so, we and our donors have some idea of, what the impact is from the donation. Other sites, they don't have ultrasound techs or radiologists, so then it's a much bigger footprint of engagement for us because we have to create a training program, identify who is the right, technologist or clinical person to train, and those are long-term projects for us.
Now, I think you've done work in Bolivia, in Ghana, and in Nicaragua, as I recall. Is that correct?
Right. So Ghana and Nicaragua are ramping up. Actually, Nicaragua, our first engagement was, 2 years ago, and then they had their quasi-civil war unrest event, and we try to keep a very safe profile. So we stopped that project, and even with COVID going right now, we're ramping that back up, and that's probably going to look like a number of Sequoia donations to district-level hospitals. And most of those have actually good radiologists, so probably there won't be much of a training footprint for us. It's just straight up capacity development. Bolivia was a really fun project. So, Bolivia is a middle income country, and for us that makes a big difference. Low income country like Haiti, there's so much infrastructure problem, lack of resources, lack of training, that anything we do in a low income country becomes typically a long-term complex project for us. Bolivia was really wonderful because they have great radiologists, they have radiation therapy, they got surgery, they got pathologists. And so this was a fun project where we got connected to a private practice radiologist who wanted to do a charitable mission in the rural parts around Cochabamba. So our part was donating some of the imaging equipment. He had sourced a truck that could handle the roads, and we built a rural mobile outreach breast cancer screening program. So it's got ultrasound, it's got mammography, and that was up and running October of last year. And again, a middle income country, they've got service engineers, they can source parts. So for us, it's been one of those quick and simple projects to create capacity. And they're wonderful people, so I'm hoping to stay engaged with them on a social level. And ironically, after all that's up and running, I met some surgeons from Mount Sinai who have been working in a different part of Bolivia. And so the plan is we're going to, when COVID settles down, we're going to try to maybe unite those two programs. These surgeons have been doing breast surgery work for years, and maybe combine them with the rural outreach program in Cochabamba and just see if we can't create some nice synergies there.
What are the biggest challenges that you face in your line of work?
Wow, that's an awesome question. There's really different categories. I spent this morning. I'm working on a paper, kind of describing, how does one build capacity in a low-income country? And I guess if there's a simple message, it's that the service and parts engineering phase of the project, that's by far the hardest. So a lot of these countries, they just don't have good bioengineers. They'll have somebody who can fix some stuff in a hospital setting, but when you get into the really complex and specialized equipment like imaging stuff, they may have somebody who just doesn't know how to fix the equipment, or they may be talented enough to figure it out on their own. A lot of folks we meet in Haiti are extremely resourceful, but they run into a brick wall if they can't get the parts, or they call the manufacturer and they won't play ball with, here's a 20-year-old piece of equipment. You got somebody in Haiti who doesn't speak the language, maybe. So that is kind of the heartbreaking end of things. I think there's a lot of folks in the charitable space. They'll come do the teaching work. They'll do the hands-on. They may come and do actual cases. They have people like us who do the equipment and the training. But when it comes to the long-term engagement it takes to maintain that equipment over years and years, that's really tough.
So money's not the problem.
No, money's always the problem. If I had enough money, I could send service engineers all over the planet. So yeah, money's a problem, and having a relationship with you, Phil, has been great because you help us source equipment at great prices or zero prices kind of thing. So that of course is always an issue. But I guess when the rubber meets the road, if I could have a magic silver bullet, it'd be finding a flock of service engineers I could send all over the planet with suitcases full of the right parts. That would make a massive impact.
Right.
But the whole value stream that we work on, front end of engagement to the assessment to whatever training needs to happen to implementing the equipment and implementing an actual clinical service, all that takes resources. It's travel expenses for us, everything.
Well, I know you're doing a great job and trying very hard, and it's been my pleasure to try to help you in a small way. And I'm anxious for you to come back in a few months and give us a report on how things are going, and
Sure.
and maybe even remotely when or next time you're in Haiti or in some foreign country, maybe we can interview you remotely.
Sure, absolutely. That'd be fun.
Thank you very much, Dr. Schmit.